Today at Amplified, we'll be discussing a widespread crime so severe that it threatens or will threaten all 143 crore of Indian population directly. Not only that, the crime is so heinous that it aims at the most purest form of relation between a child and the mother. This is the most important video we have ever made, as lakhs of families have been or will be affected directly. So watch this video till the end. Also, like and subscribe as that's the only way the video can reach out to those who need it. I shall do no harm. The very essence of the Hippocratic Oath. The oath that each doctor must uphold to the best of their ability. And not only few doctors are not upholding it, but destroying its very essence for the profit. Welcome to MBA5 new series, The Dirty Business, wherein we will cover the darker side of the businesses and how it corrupts everything good in the world of business. Today we'll be seeing how one of the most respectable professions is causing willful harm to one of the most purest form of relation between a mother and a child.
बट डॉक्टर वो लोग कह रहे हैं कि जब तक नॉर्मल डिलीवरी हो नहीं जाती वो लोग वेट करेंगे।
अरे नॉर्मल डिलीवरी होएगा तो बेटा हॉस्पिटल में माल कहाँ से आएगा? हाँ? और तुम्हारा सैलरी कहाँ से आएगा? नॉर्मल डिलीवरी इज नॉट पॉसिबल, यू मस्ट गो फॉर सी सेक्शन। वेट करेगा तो हम रिस्पॉन्सिबल नहीं होगा। उनको दो चार बड़ा बड़ा मेडिकल टर्म्स चिपकाने का।
This is a very famous Bollywood movie scene of Gabbar, which tells us the exact story of C-sections in India. First of all, let's understand what is C-section. In the worst case scenario, when the life of the baby or the mother is in danger and normal delivery is not possible, then the mother's abdomen is cut through 7 layers of skin to take the baby out, so that both can be handled separately. World Health Organization suggests the rate to be 10% to max 15%. Take an average Indian woman going to any obstetrician clinic in India. It is quite possible that she will be recommended an unnecessary C-section. In fact, the possibility of it being suggested is 80%. No wonder the rate of C-section in private hospital is staggering 60% in some states. Every year, as many as 6.6 million babies, but the size of the island's population, are born in India through C-section. This brutal capitalization of basic healthcare is becoming a termite. At the rate of C-section in private hospital has jumped to more than 400% since 2008. And this has become so prevalent that patients are asking for C-section delivery. Since when does a life-saving worst-case scenario procedure become so mainstream? One of the reasons is that family don't even know the risk involved.
मैंने इसलिए फ़ोन किया था पंडित को ये पूछने के लिए कि इस टाइम कुछ ऐसे ग्रह तो नहीं चल रहे, कोई मूल के ग्रह हों या कोई पंचक हो। सिजेरियन करते हैं तो पंडित से टाइम लेके करते हैं कि पर्टिकुलर उस टाइम पे कर रहे हैं हम, तो उस टाइम पे कोई ग्रह नहीं है, कोई कुछ नहीं है।
7 layers of skin is been cutted, 5 times more likely to die as compared to normal delivery. Wound infection, injuries during the surgical procedure, not only skin but nerves are been damaged, which may result in the nerve entrapment syndrome, meaning women feel pain way after the recovery and for months. You must have heard the C-sections are safer than normal birth, but the truth is actually quite opposite. In normal birth, the mother is able to carry her life in 1 to 2 days after the birth. But this is not the case with the C-section. So while your stay in normal delivery is 1 to 2 days, while in case of C-section, the post-op procedure can take about a week. Also, there are muscles that have been cutted, which may result in as small as back pain to complication into the next childbirth, as abdominal muscles that were meant to hold your body and the child were been cutted. And the risk is not limited to mother but to the baby also. As per Reuters, the risk of developing respiratory disease like allergies and asthma in a C-section baby is 4 times that of a normal birth when done pre-labor. As in normal or vaginal delivery, child carries microbes of the mother as it comes out and it protects the baby. Now that we understand the risk involved in C-section, the next big question is why do hospitals push it? First of all, Most of the deliveries, almost 97%, happens in small private hospitals or clinics, which means there are limited resources, and the resources that lack the most are money, time, and logistics. Like C-section can be done in under an hour and gets charged almost 70 to 80,000 rupees, while a normal delivery can take about 8 hours to 2 days and charge 10 to 20,000 rupees only. The logistic involved also matters, as even a slightly complicated delivery requires the whole medical staff to be on the standby, which is not normally billed to the patient. So small hospitals have to bear the cost. A serious illness is a rare event, but childbirth is a normal event, meaning every woman would go from 1 to 2 childbirth. Imagine if we are able to commercialize this natural process into a medical intervention. How big of a market that alone would be. In India, mothers have the right to choose whether they want to go for C-section or normal delivery. But my problem is how they force or convince the patients. Like they would mention some superficial complication just to convince them to go for C-section. Like your baby might be in danger or is in fetal distress. They might go to the level of inducing labor forcefully through medicine, which is only done in the worst case scenario. One common drug that has been administered is pitocin or oxytocin, which will be euphemism if I tell you that it has been overused. According to NCBI report of child delivery in home, 76.4% were administered oxytocin by auxiliary nurse or midwife, and the dose is ranging between 1 to 5 times. At healthcare institution, 23% were administered oxytocin. The most common reason doctors give for C-section is umbilical cord around the baby's neck.
Tell that it can strangulate the baby, but that is not true. As the baby moves down, the birth canal and the placenta also moves down. For the baby, it is a very natural process, but for the mother, they start visualizing baby getting strangulated because of the cord. Okay, so that is the fear or the panic factor that sets in here.
One common reason for why this is happening is lack of protocols in Indian medicine as to when this C-section is required and when not. Also, how doctors are incentivized, like a large number of senior doctors work as a consultant and are paid to the number of surgeries they perform. And it doesn't look like the nightmare is going to stop anytime soon. As doctors in hospitals are more ready for C-section than a normal delivery. Conducting a normal delivery requires a separate set of skills, training which has not been practiced enough. As hospitals are rushing towards more lucrative C-section, medical schools, which are often teaching hospitals, do not give enough exposure to normal delivery to incoming students. The consequence being, we are leaving an entire generation of doctors who are not equipped to handle a normal delivery. That's all for today. Comment what are your thoughts on this heinous international epidemic. Plus, also tell us how you find the series of Dirty Business. And don't forget to like, share and subscribe to MBA Fight.